Staff, are you ready to go?
Good evening, Madam Chair.
I understand there's not a quorum yet.
I think we just got our third floor quorum.
We did.
Okay.
Thank you.
That would be,
Just jumped in.
Councilman Chris Johnson.
okay, that is
All right.
the third one.
Stand by.
Okay. Good afternoon, everyone. This meeting will now be called to order. This is the Public Safety Committee meeting for February 14th, 2022. I'm chair of the Public Safety Committee. I'm a council member at large, and my name is Loretta Walsh. At this time, I will call for the roll of the other members of the committee first. Linda Gray, Chris Johnson. Here. James Spadola did get an excused absence today. Council President Trippy Congo.
Here.
Other council members who are not on the committee but are in attendance. Maria Cabrera. And I believe that's it. If there's any other council member, please raise your hand. Okay, why don't we get right
Councilmember
to it?
Cabrera is here.
Yes, I just
Councilmember
said that.
Cabrera is present. Okay, sorry.
Yes, I just said that.
Sorry, didn't hear you.
That's all right. Okay, why don't we start immediately with the agenda? We have a resolution from the Office of Emergency Management. For funds allocated pursuant to 2021 Emergency Management Performance Grant, Supplemental American Rescue Plan Act.
Yes,
Who's
yes, ma'am.
speaking on this one, please?
This is Willie Patrick, Director of Emergency Management. Yes, Madam Chair. This is a supplement to the EMP grant that was approved by council last month. It's for $36,000, and in essence, what it is that when we originally submitted our grant application to DEMA as a subrecipient, they cut $36,000. Later on in the process, ARPA funds became available, and they notified us that we could submit a supplemental grant for the amount that was cut. There's no fiscal note to this, and it's really, and the guidelines really are consistent with the EMPG grant.
But there is a local match requirement that you've already met, is that correct?
That's correct.
Okay. Council members, anyone have any questions? Any from the members of the committee? Anyone else on council? Anyone from the public who would like to make any comments on this? Okay, seeing none, we will go to the next agenda item.
Madam Chair, we do have a
Yes.
member of the public.
I do, and who would that be?
That would be Mr. D. Marquis Hall.
Okay, Mr. Hall, you have 3 minutes.
Hi, thank you. This is Devon Marquis Hall, and my question is for Mr. Patrick. I want to know where the money's going, what the money's being used for, what is the purpose for the grant. I understand that we have the matching grant already, and we're getting more money. I wanted to know what exactly it's going towards. Is it going to help the people that need housing, that have been displaced, that are still homeless in Northeast Wilmington?
No, sir. Oh, hold on. Let me make sure no. So the grant, the guidelines of the grant is that it's used for the administration and operation of the Office of Emergency Management. So it's in essence, it does is administrative functions of the office and to operate the Emergency Operations Center in the event there needs to be an activation of the Emergency Operations Center.
So the money's going to your office, your staff?
Yes. It goes to the $36,000 goes to the operations of the emergency management office. Yes.
How many people are working for you presently?
It's one person.
You're planning on getting more people?
Pardon me?
Are you planning on getting more people in the near future? If so, when?
That has not been discussed with the mayor's office, but yes, we're always looking to get more staff, right, to be more effective in the functions of our duties. But that's limited by the budget, and so at present, there's no plans to add to the staffing of the Office of Emergency Management.
I've got one more question. Could the money be used to help the people that are still displaced?
So, Mr. Hall, as I stated,
Yeah.
is the grant, there's
Not
guidelines
this
for the
money.
grant. Pardon me?
This money can't, because it's already written out exactly what's going to be used for, but is that a priority of your office to try to help those people?
It is, sure, of course. That's why we're active participant in the long-term recovery group, and all the other functions that we're doing in support of those who were affected by the September 2nd flood.
I haven't received a reply email back from you or anyone else that was in that meeting on Thursday.
That's something completely different, sir. We're talking about the grant right now.
Thank you, Mr. Hall.
You're welcome. Thank you.
Okay, we have someone from the 3rd NPC district. Please state your name.
Okay, thank you very much for taking my call. My name is Jan Dennis. I'm the chairperson of the 3rd District Neighborhood Planning Council. And on this grant here, I'm a little concerned. I understand it's going to be used for administrative purposes, but I am concerned about the 2 emergency alarm systems, 2 alert towers that are located in the 1600 block of Pine Street, and another one in the 800 block of 23rd Street, which neither one were used on September the 2nd to give.
Mr. Dennison, I'm sorry to interrupt you, but we're going to address them in just a moment. This is concerning the grant for the operation of this department.
Okay, that's good. But now this $36,000 that he's speaking of that Dean was giving him, if them 2 towers were not working on September the 2nd, is it any way that some of that money could be used for that early warning system? Now, I'm aware of the Emergency Management Center that's over in South Bridge. A lot of people are not aware of that place, but it is so in other words, this $36,000, is that going to be used cheap to get the center up and running so that the people in the 3rd District, Northeast specifically, being as the F2 area, will be having an early warning like they did in 2014.
Mr. Dennison, I hate to interrupt you again, but I have to. That the $36,000, as the director said when we started this, was taken off of what was applied for the last grant, and then it was restored. So
Right.
this is just making up money. This doesn't have anything to do with the towers right now.
Okay,
This
so,
is just for the day-to-day operation
okay,
of his department.
okay, so will I be able to speak at the time?
Yes, you will.
Okay,
Yes,
thank you
you
very
will.
much. Thank you.
You're welcome. Anyone else? Council members? Hearing none, we'll move on with this. We do not need to vote on this because it's a resolution. Only ordinances need to be voted out of committee. Ms. Cabrera,
Yes, ma'am.
would you like to do the update on the alert system first and then do your resolution? Since
Whatever
we're
the-
talking about something that already exists, we can do it whichever way you want.
Whatever the Madam Chair, I'm fine either way. I'm fine with your suggestion.
Okay, let's do the update on the emergency alert system first. Director, if you could, please.
Okay, so thank you, Madam Chair. So currently there's 13 locations around the city where the emergency sirens are installed. There were this system was installed in 2007. These sirens are activated, can be activated from Wilcom and from the Office of Emergency Management, and it also can be activated from our mobile command unit. The system works where you can activate one siren, or you can activate all of them. They're tested annually we contract with Baycom, who is a contractor who maintains our system, and they're tested annually. And we're in the process of updating the system, servicing the system, and it's going to be tested next month. I think that we are working with Lieutenant Green from WPD, and we're targeting March 24th. I think the lieutenant and I had agreed upon to do an audible test. Like I said, because now this is all computer driven, you can test the system from the contractor's console just to see the operability of the system. And that's it. So as I stated, the system was installed in 2007, and just like I understand that there's going to be a resolution that follows this to support the Senate Bill 247B, which speaks to the IPAWS system, to the WIA notification system. One of the things that we've upgraded to is a system now that doesn't require a notification by sirens, but it touches every cell phone within an area through the WIA system, which is the wireless emergency alert system. And then there's also within that system is also the emergency alert system, which is the broadcast system that comes over your phones. Your television and your radios. So I'm happy to say that as of last week, a couple weeks ago, now the city of Wilmington and every county in the state of Delaware has capability, which is called IPAWS. It's called Integrated public alert warning system. Every county in the city of Wilmington now has capabilities to activate iPaws. And that's it.
Thank you, Director. I'd like to acknowledge Councilmember Gray in attendance and also Councilmember Darby. Are there any questions from the committee members? Seeing none, are there any questions from other members of council? Seeing none, Mr. Hall? Keep it to 3 minutes too, please, sir.
I think Mr. Dennis was gonna speak about this. He
He
is
is.
the person that
I'm not going to miss Mr. Dennis. He will speak.
because I wouldn't have known anything about this this system that wasn't utilized back on September 2nd if it wasn't for Mr. Dennis. And these loud speakers, these loud microphones, these emergency response pieces of equipment that aren't always utilized need to be used to protect people. They need to be used to let people know what's going on. I don't even know if Mr. Patrick's office was aware or notified or even in existence back before September 2nd.
It's
Is
been
that
in
something that
existence for
you know?
years, sir.
I didn't know. I'd never met him before everything happened on September 2nd. So I'm not surprised that the system wasn't utilized if he's the only person in the office and it was a disaster that nobody saw coming. I'm not surprised that those speakers weren't used, but I did want Mr. Dennis to elaborate more on the situation because he is the person that made me aware of these microphones that were not used and haven't been used for too long.
Thank you. And Mr. Dennison will get his time. Mr. Dennison, would you like to ask your questions now?
Oh, yes, I would. Thank you. Yeah, on this system, I am aware, and I did make Dee aware of them. And back in 2014 or 2015, whatever it was, the last one, I forgot what city council person was. He was either Eric Robinson or Darius Brown at that time. But them systems did work. Now, whether or not they work now, but at the same time, they did work and they did sound out to the community. I think Chief Patrick was fire chief at that time. What happened is WPD came through the community. I lived on 17th Street at that time. They came through the community on 17th Street and on Vanderbilt Avenue, giving early warning to people, giving them plenty of time to be able to gather what they needed to do and get out using the Route 202, which is the emergency evacuation route for the city of Wilmington, to get out. Now, why that wasn't done on September the 2nd, I don't know. I find it to be a failure with the city of Wilmington, the Office of Emergency Management. I understand Chief just got there, but it's his ball. And then not only that, the city council person as well, because with that being an F2 area and them sirens not working, a lot of people could have gotten cars out. They could have got personal belongings out with early warning. And I lived there, so I know. And that siren is right there directly behind Moyer Academy. And then there's another one right there on the 800 block of East 23rd Street. So this money and that sirens, that needs to happen because that is a flood stage and they're no longer 100-year floods, like every 10 years. So it's just like I've talked to Senator Brown about the low-lying areas. I see they did it in South Market Street, which we got low-lying area on 12th Street. We got North Market Street. We got Governor Prince Boulevard. And the only way to get out of the city is straight up 202. but that's need to be dealt with as well. So a lot of people don't know that, and they should know, and now they do know. Them sirens, they need to be working, because for the next time around, people have lost a lot, and I really feel as though they could have saved a lot by having that done. So someone dropped the ball. And I think I was kind of waiting for somebody to take ownership of that. Seems like no one done from
Mr.
September.
Dennison, you have 20 seconds.
I see the number.
Okay.
And so therefore, city council person, first of all, because it's her district. That's her resident, that's her home. They are her people. She should have been known what was going on. Thank you very much for your time.
Thank you. Representative Larry Lambert. Representative Lambert,
Hello, can you hear me now?
yes.
Excellent. Thank you, Madam Chair, for your leadership on this Public Safety Committee. I want to thank all the other members of council who joined. I want to take this opportunity to thank Councilwoman Cabrera for her leadership in the EJ space. I'm State Representative Larry Lambert. I am the House sponsor of HB 259, House Bill 259, the bill for wireless emergency alerts during catastrophic chemical releases. And I also want to thank Mr. Patrick for his service in the city of Wilmington. While it's true that the city and the counties have the ability to utilize the IPAWs, the wireless emergency alerts during catastrophic chemical releases, this bill, which is out of committee in the House, and we look forward to it coming to the floor for a vote soon. This bill would require that when there is a catastrophic chemical release, that is a release of substances that pose an imminent and substantial endangerment to public health, we are working to require that an wireless emergency alert be sent out to the geographic area of impact, the blast zone, if you will. And so many of our communities of color, our overburdened communities, live in these sacrifice zones. So in that regard, we want to make sure they're as safe as possible. During the Crota ethylene oxide leak of 2018, where my brother and my nephews live right in the footprint, there was a decision made that wireless emergency alerts went out to individuals that did register their cell phones with the Code Red system, but unfortunately only 3% of Delawareans are registered with that. So this bill is not a critique of the outstanding work that Mr. Patrick and others do. It's actually a compliment. So right now, you do send out alerts to landlines of individuals within the geographic area of impact. This bill simply complements that by also including an alert that goes out to cell phones, as the majority of Delawareans and Americans, for that matter, in the year 2022, no longer have landlines. They utilize wireless cell phones. So in that regard, this is a big thank you to all involved. And thank you, Maria, Councilwoman Cabrera, for this resolution in support of HB 259. Thank you.
Thank you, State Representative. Donald Farrell.
Yes, I would like to thank Mr. Lambert and everybody that's talking about this issue. My name is Don Farrell, and I live on the East Side. And on the East Side, we have a chemical plant that borders Southbridge and the East Side, and that is Noramco. And thank God they have had a very good safety record up to this point. But I mean, anything could happen. I had a question. Mr. Patrick had mentioned notices going out on the TV. I wanted to know if it's the city television station, Channel 22, or will it be 3, 6, and 10? Also, I had a question about the evacuations alerts. Will they be different? And how will the community know if we should shelter in place or we should evacuate the area? Or
Okay, we're getting, excuse me, Mr. Farrell, we're getting off on a whole new,
well, it was
subject.
dealing with the alert, and that's what I was asking about. So Mr. Patrick mentioned the alert coming over the TV, and I just had a question. Will they be alerts on the city station, or will they be the city station, including 3, 6, and 10? And when these alarms are repaired and operable, how will the community know what to do? Thank you.
Thank you, Mr. Farrell.
Madam Chair,
Yes.
can I speak to that?
Yes, Mr. Director.
Okay, so Mr. Farrell, that's a great question. So if you ever notice when we're having a storm and you get those alerts that come across the TV, that's the ESC system. I'm sorry, the EAS, Emergency Alert System. That's the broadcast system that comes over your 3, 6, and 10, and it comes over radio at the same time. That's the broadcast system. And also, under that same umbrella is the wireless emergency alert. And you ask about how do you get notification? How do you know what to do? Well, that's when we come by, and we hit every cell phone in that area and every landline in that area with protective measures. What you need to do, whether you need to shelter in place, whether you need to go execute your evacuation route. So no, so that messaging does not go to ITN, WITN channel 22. It goes to the major television networks. And then protective measures, what you need to do is broadcast over cell phones and landlines.
Thank you, Director. Councilmember Cabrera, would you like to move on your resolution, please?
Yes, ma'am, I would. And just want to thank everyone for already speaking to parts of it. And thank you to State Representative Lambert for being in the meeting today and to speak to his resolution, which, yes, after reading the resolution, I didn't realize that there's such a deficiency in getting information out to people because of the changes and the technology and, you know, the time that we're living in now. So as he stated, and I will give you some data here, what this resolution does is it makes it the way that the federal alert system works. Everyone's cell phone numbers are automatically registered to receive information when there's something of a federal nature that everyone has to be reached out to. So our cell phones will ring and we'll get the information or text messages. In Delaware, however, the people who have landlines is 6.74%. Our emergency system is only calling the landlines and anyone who has registered to receive those notifications on their cell phone. And that number right now is only 3%, with about 62.5% of adults and 73.8% of children using cell phone only as communication. That means that those alerts from the state's emergency notification system, unless they have registered for them, and think how many times some people change their cell phone numbers, and if they don't register every time, they're simply just not getting those alerts. So from what I understand, and of course the sponsor can elaborate if need be, is that there is a challenge when there's the catastrophic events that we need to let the public know, and events that could have severe health consequences or the health and safety of the public health. Those are significant and they need to be sent out as fast as possible. as we're hearing the conversation, there are some deficiencies. Our towers weren't working when Hurricane Ida came through. We don't have the cell phones for people to get the information. And even with WITN, which is on cable Comcast, not everybody has Xfinity or Comcast as their provider. So they would not see that on channel 22, even if we did add it to it, which I'm sure that we would. So what this does is not only include so that Delaware can automatically add the cell phones like the federal government does, but it also adds a language. 13% of the households in Delaware are Spanish speaking only. So it is important to also reach people who do not speak that language. Actually, 13% of the United States population speaks Spanish primarily at home. And I'm sure the percentages are high here in Delaware. So what this does, it makes it language relevant, as well as making sure that everyone who has a cell phone, and that's the only means of communication that they're using, is able to get an alert. And this is a resolution supporting the House Bill 259 that State Representative Lambert is introducing. And I thank him for being on this call and this meeting and speaking to it. If anybody has any questions, I'm happy to answer them, or Representative Lambert.
Thank you, Councilmember. Councilmember Johnson?
Yeah, thank you very much, State Rep Lambert, for joining us tonight. And this is the first time I've, kind of been privy to this EJ issue. So I thank you and Councilmember Cabrera for introducing this. The only question I have is, it seems to be the language is explicitly only for gas releases. Is there any thought in the future of making it so that it's applicable to other types of causes like tornadoes or flooding or any other, occurrences that could happen? So I'm not sure if that's already in place, or will we need to do an amendment in the future so that it can expand to all types of, matters.
Director Patrick?
Yes, ma'am.
Do you have an answer for that?
Well, I think he was directing that to Representative Lambert.
It was really to anyone, because it just seemed explicit to only gas release, which would be applicable, I guess, for the disaster like CRODA.
Right.
I guess to put it in simple terms. Now, is it applicable
Yes.
to other types?
Yes.
Or?
Yeah. So to answer your question, Councilman Johnson, yes. Because of the fact that the system, the IPAWS system, which is in essence what this is, the WIA and the EAS system is all part of the IPAWS system. So any type of emergency where notification needs to be made, you can use this system. So now that we are what they call a COG, it means that we have authority now to send messages to IPAWS. We can use the system now for any type of note, as long as it's deemed emergency in nature, then we can use the system for notifications. And in that system, we can, and how it functions is that we geofence that whole area, a geographic area, and it sends a message out to every cell phone in that area. So whatever the incident might be, whatever the nature of the need might be, yes, we can use it for that. Although, and I read the legislation also, and just let me take this opportunity to thank Representative Lambert and all for bringing this to the table. And I also want to thank Senator Hansen for meeting with the emergency management representatives to I guess hammer out some concerns about the legislation, and I'm thinking, I hope I'm correct, Representative Lambert, that you guys were able to come to some consensus about how to move forward with the legislation.
Representative Lambert,
Hello, yes, thank you, Mr. Patrick. Yes, that is correct. We had a robust meeting on Thursday, which was the third time that we all met. Meeting included DEMA, Newcastle County Emergency Management, DNREC, I believe a member of your team, and yes, Senator Hansen, which is the Senate Prime. We've been working out all of the details. Like I mentioned earlier, this bill really complements the outstanding work you do. And right now, it is accurate that it is the current procedure after the ethylene oxide leak of 2018. In 2019, it became the procedure of numerous entities across the state to proceed in this way. But the difference between a procedure and a mandate is that if a leader in the future decided to roll back this procedure, they willfully could. We want to make sure that we mandate it so that going forward, all communities feel as safe as possible. And Councilman Johnson, thank you for your interest and your support in EJ issues as well. The bill states that a catastrophic release means a major uncontrolled emission, fire, or explosion involving one or more regulated substances that present an imminent and substantial endangerment to public health and the environment. So in that regard, when it comes to severe weather emergencies, when it comes to Amber Alerts, things of that sort, those are regulated at the federal level. So you will already receive wireless emergency alerts in the geographic area of impact. Here in Delaware, as Councilwoman Cabrera added earlier, catastrophic chemical releases or extremely hazardous substances releases, those aren't already mandated to require a wireless emergency alert. And that's what this bill will do if our colleagues in the General Assembly vote for it.
Okay, thank you very much. That's a full explanation, and please let us know what we can do in council to make sure this passes through. Thank you.
Representative Lambert. Besides passing this resolution, is there anything else you think that this council and or our citizens should be doing to help you get this passed?
Just continue to remind your local representatives to support the bill. A number of your representatives in the city of Wilmington do support it, but we do want to make sure that there are no gaps. Running for office, I recognize some of these gaps, and I've been an advocate in the EJ space for years. And I just want to thank you for your leadership, Madam Chair, and everyone on the call. It's important that we continue to work together. The city of Wilmington has always had a great relationship with Claymont. We're a little brother city to the city of Wilmington. So partnerships like this and with Councilwoman Cabrera really help to ensure that all of our families are as safe as possible. Thank you.
Thank you. Would anyone else like to make any comments?
No, I'd just like to be recognized, Madam Chair.
Thank you. Councilmember Oliver is in attendance. Okay. Thank you, Councilmember Cabrera.
I see two hands up. I'm not sure if they wanted to speak to this. In closing, I just want to also thank the Sierra Club, who is in support of this, and just continuing our work on environmental justice issues. And this is just one of them, but in turn, it will help out for other things that might not be included with the federal emergency system. And it's just a better way of keeping our communities safe. It's a start. There's a lot more work to be done. The question was asked, how can people be helpful? I think it's important that people get involved in the environmental justice movement. There's monthly meetings. Representative Lambert and myself are part of that. There's a lot of work to be done. And many times when we show up to meetings and events to take a stance, there's just a few of us and there's hundreds of them. So one way is that you can reach out to us and get involved, come to our meetings, come to our events, and help us push forward as we try to keep our environment safe for all of us, so we can breathe better, have less illnesses in our community, and keep our community safe. And this is just one piece of the many things that we're working on for the state of Delaware, and specifically for the city of Wilmington. So I thank everyone on the call today.
Thank you. Mr. Farrell, I believe you had your hand up. This is last call for hands too.
Yes, I do. I'd like to put on record that I'd be interested in participating on your EJ committee, as I'm quite sure that there's other folks also. We have also been interested in environmental health issues. I have a question for Representative Lambert. Realizing that Mr. Patrick has limited resources.
Okay, Mr. Farrell, we really don't use
I
this
just
for
have a question. I just have a question I'm trying to ask. Has there been any consideration to create community response teams so that folks who are interested in these issues in the event of an emergency can also contribute to the effort to help inform people and let folks know what's going on? Representative Lambert.
Mr. Farrell, it's probably more of a question to me. This is Mr. Patrick. That's probably more of a question to the Wilmington Office of Emergency Management.
It is.
So yes. So there is, and we encourage the neighbors, our neighborhoods, to be involved in this, what we call the Citizens Emergency Response Training. We've been trying to organize that training in communities. One of the challenges is that during COVID, you couldn't gather and you couldn't get together. But now that we're coming out of that, and now we're getting to a point where we can get together and have that type of communal type training, because it is hands-on. It's a commitment. It's a commitment of a Friday night and all day Saturday to attend the training. Also, I would just want to just make you aware that there is also in Newcastle County, they run for the community response trainings during the course of the year. So between and a lot of times we try to advise the residents who, if we can't get at least 10 people, because we need at least 10 to 12 people to hold a class. So if we can't get enough people to hold a class, we'll steer them towards the Newcastle County class. And then there's a statewide cert training also. So I'd be glad to talk with you, Mr. Farrell, about maybe trying to get that organized. One of the challenges, as I stated, is the commitment, whether or not everyone's got busy schedules, everyone's got a lot going on. But if we can get 10 to 12 people to carve out about a day and a half, it's a Friday night, all day Saturday till like about 4, that would be great. So I'm going to put my number in the chat. Give me a call.
Thank you, Director. The next person, this is concerning House Bill 259. DeMarquis Hall.
Yes, I just wanted to thank Rep. Lambert, and I wanted to thank Maria Cabrera. I wanted to thank you guys for championing this legislation in the state and in the city. And I know that it's going to help Willie Patrick and his office to better serve our community, especially the marginalized community living in low-lying flood areas that need so much help. Thank you.
Thank you. Kobe Owens.
Yes. Hi, everyone. My name is Kobe Owens. I'm here tonight on behalf of the Delaware Sierra Club. I'm an executive board member and the co-chair of the Environmental Justice Committee. Again, I would just like to reiterate our support and gratefulness for Representative Lambert for introducing HB 259 and Councilwoman Maria Cabrera for sponsoring this resolution. We hope that it passes with overwhelming support, and we thank you all for taking this issue up. Thank you so much.
Council President Congo.
Yes, thank you, Madam Chair. I have a question for Director Patrick. What is the policy now for notifying the guess I'm leaning more towards elected officials when there is a natural emergency? I asked this because one of the community members, they were looking for guidance from their elected official, but I'm not sure if we were even notified in a timely fashion. Is there a policy in place that notifies elected officials?
Yes. So, Council President, yes, there is a policy, and it's all defined in our emergency operations procedures. All those who are part of, and you're part of that notification. All those who, when we have an activation of depending on what level of our emergency operations center, all those are elected officials, all those department heads who rally to activate the emergency operations center. They are notified. One of the great things now about having these emergency notification procedures, the DEN system, and now which uses RAVE, it'll send a broad message. So we can send messages by email. You can send messages by text message. You can send messages by cell phone, all at the same time. You can send, so when we send the notifications, we can hit 3 different means of notifications, all with just one message.
Is that what happened? Just a follow-up, Madam Chair.
Yes.
Is that what happened on September the 2nd? I just don't remember receiving a notification.
We send messages out. Yeah, we send messages out.
Was it email or was it like by phone, like a text?
It was by email.
Okay.
I think it might have been both, Council President. I think it was both, by email and by cell.
And that goes for just to me as a department head or all council members?
No, it goes to you as the Council President, and I think we also sent it to the district rep, to Councilwoman Aller.
Okay, just one more follow-up, Madam Chair.
Yes.
If I could just recommend that notification going to all council members. I just don't remember receiving it's definitely not a text. I think I first heard about it when somebody sent me a message, then it was on social media. But that could be discussion in your office, that kind of notification could go out to all council members immediately. That would be appreciated.
We'll definitely take that under advisement.
All right, thank you.
You're welcome. Mr. Dennison. Third District.
All right. I got you, and thank you very much for taking my call. This message is for this comment is for Mr. Patrick. I have been calling your office. I'm certified, and I've been calling your offices, leaving messages with Marjorie.
Williams.
Williams. Yeah, she hasn't returned my call because myself and Don Farrell, that's what we have been trying to get together. I'm certified also, but trying to get emergency response team in the city of Wilmington, specifically, along with AED, first aid and other things, stop the bleed. So she has returned my call. So you said you was going to put your number in the chat. I would like to have that so I can contact you.
Okay, we can do that. You know what? And I really appreciate the help. And I'm sorry that you didn't get a return call, but just let me say is that this type of dialogue is needed because of the fact that, if we can get enough people with the interest, like I said, Mr. Dennis,
Yeah.
We need at least 10 to 12 people for DEMA. DEMA is the one who
Yeah, I know.
So
Yeah,
yeah,
I'm familiar. I tried to do it in the third district about 10 years ago, and I couldn't get over 5 people. So now that this IDA has happened, I'm sure there would be a genuine interest. And yes, definitely, they would have to dedicate some time. But not only that, it's a very good thing because see, having the AED, emergency stop the bleed, all of that, CPR is very good, and that's what I trying to do with my nonprofit I established. So if you can, put your number in there. I'll give you a call.
I'm doing it now.
All right, thank you.
Thank you for your help.
Thank you, Director Patrick. Now we'll move on to the next item. Presentation by the Wilmington Police Department. I'm sorry, an update on Wilmington Fire Department's recruitment efforts. Chief Looney, are you here?
Yes, ma'am. Good evening, Madam Chair, and all
Good
city
evening.
council members. If I could get started, our recruitment, our objective obviously is actively participate in recruitment now to maintain our manpower and remain efficient in operation. Currently, we are 2 positions down from our authorized strength of 156. However, by the end of February, we will be down a third. So we're anticipating before spring approximately 6 to 7 vacancies, and we are submitting in our FY 2023 budget for an academy. And if I could just kind of recap what we've done in the last couple of years into where we are now currently with our recruitment. Back in 2020, the administration, the Fire Prevention Division, and several members in suppression created a recruitment task force to identify and recruit a diverse pool of applicants for our 41st Academy. This initiative was instituted due to our internal review of recent academies lacking diversity. Through this task force, the hiring process was discussed in length and reviewed for areas that needed to be revised to be more inclusive. With that being said, we moved into the hiring process with our physical agility test. We standardized the physical agility test score to create a more inclusive and equitable test for a range of physical abilities. And to move on in the hiring process, so as a pool of candidates moving on. And then the next step in that hiring process is our written test. The written test, which was found to be a major impediment to our candidate pool, was reviewed and replaced by another test to include components such as character assessment and general aptitude. This replaced a number of past written exams that weighed heavily on like an SAT style questions. Following a written test, there's a third party vendor that we contract with to supply us with the written test. They score it and establish a cutoff score that would recreate no adverse impact. So we move on with a diverse pool of candidates going into our oral interviews. We also did some changes there. The oral panel interviews were relatively unchanged in terms of questions asked to candidates and the scoring dimensions. However, a cutoff score was determined by human resources to reflect a non-adverse impact, meaning each step we continued to move a diverse pool of candidates. What we wanted to do is basically every step after the physical agility test, if you moved on, you had a clean slate. In the past, it was a cumulative score as you continued on in the process. So we felt it was more fair as you go through each testing phase or hiring phase, you would, as you move on, you're starting a clean slate. With that being said, currently, we don't have a dedicated recruitment team, but right now we have formed what we're calling a recruitment focus group to address and identify recruitment strategies. Members assigned to this focus group are myself, along with my administrative staff, the fire prevention staff under the leadership of Deputy Chief Pabone and his staff, And we also have Suppression Battalion Chief Demetrius Todd are all part of this focus group. We've already established a weekly meeting with the recruitment focus group. And this group has already produced items to address and has made strides in beginning our recruitment effort. Basically, we're trying to get ahead of this. In the past, our recruitment over the years, we based it a lot on, advertisement flyers, ads in, papers, and going to different, social media sites. But just in the last 2 years, we've aggressively increased our recruitment efforts. With that being said, we've established a advertisement flyer of hiring information sessions that we want to push out here very shortly. And basically, it's we will hold these sessions virtual, and as time goes on, in person, to basically, put out what the hiring process is all about, all the steps, and give, it's also a recruitment measure, bringing individuals in so they can see what it is our career is as a firefighter, emergency medical technician, kind of introduce them to that. Also, we have a website, and we're in the process of updating our website that is separate from the city of Wilmington. And that website is dedicated to our recruitment. And throughout that website, we have we explain each of the hiring process. We also give tips on the physical agility test, so you could be successful. And we have a dedicated link. It's WilmingtonDEFirecareers.com. And on that website, we have what we call interest cards, just like you can access from the city of Wilmington's website. We have interest cards. And these interest cards, once we receive them through our website, that person is contacted via email that we've received it, and we keep them updated as when the hiring process will begin. We've had a lot of luck with that this past class back in 2020. Our interest cards, we push out all our interest cards to all our suppression personnel out on the apparatus, so when they're out in the public, which our men and women are out, every day interacting, on runs, after runs, building inspections, and they're interacting with the public. And a lot of times they're out there, handing out interest cards and letting people know about, our department and careers with our department. As I said earlier, we're going to be scheduling some online Zoom information sessions. Once we get, after this new fiscal year, once we get into that, and we're getting closer to having to start this hiring process, we'll also have a billboard campaign, which we did the last class, which was very effective, and we got great feedback from that. We also, we have a social media action plan. We have our own Wilmington Fire Department Facebook page, along with Instagram, that we will be using as a recruitment resource. We're also in the planning stages of in-person visits. We're going to be using that handshake app to put our message out, and then development stages of internal recruitment. Our men and women are could be some of our best recruiters. They have friends, they have family, they know the job, they know this profession. Obviously I give credit to them. They can be one of our best assets. And I will personally reach out to any and all the city council for any advice and ideas for our recruitment drive. But as I said, started off with earlier, we're currently down 2, we'll be down 3 by the end of the month. I do foresee an academy in the fall with probably 10 to 15 recruits.
Thank you, Chief.
Thank you.
Council members, any questions for the chief? Members of the public, any questions for the chief?
I had a question, Chairwoman.
Who is this?
This is Chris Johnson.
Oh, Chris, I'm sorry.
No
Your
problem.
hand was not coming up on my screen.
No problem.
Councilmember Johnson.
Chief Mooney, thank you for the comprehensive overview, the process. Does the fire department currently accept lateral transfers? So say individuals who are, certified in volunteers company, could they transfer to Wilmington without taking fire school?
I know other departments throughout the country are doing just that. We have not done that. It was many, many years ago that we actually brought on certified firefighters. And that was through what we call a SAFER grant through the U.S. Fire Administration. But currently, we don't do that.
Is there, and if I could have a follow-up, Chairwoman, is there any discussion about that as a way to possibly open up the application pool to perfectly get a more diverse workforce?
I mean, we could have this. Yes, we could have discussions about that. My only concern is, we're going to get a lot of, I would say, applicants from outside the city. I mean, it's, we're not going to give, a valid chance for those that are in the city.
Okay. Understood. Thank you very much, Chief.
You're welcome.
Chief, piggybacking on what Councilmember Johnson just said, I also believe years ago that the police department, they were able to transfer to the fire department and vice versa. Is that still true?
Yes, ma'am. It's been a while since we've had a WPD officer laterally transfer over to the fire department, but yes, it has happened. And we, in turn, we have had at least one or two. I know of one that did a lateral transfer over to WPD.
Interesting. Any other council members who have questions? Any members of the public? Well, thank you, Chief, for your time. I appreciate it.
Thank you, Madam Chair.
We'll see
Thank
you
you,
again
everybody
soon.
else. Excuse me, ma'am?
We'll see you during your budget hearing where they're,
Yes, ma'am.
don't forget the police class or the fire class you're going to have in there.
All right. I'll be ready.
Okay.
All right. All right. Thank you, ma'am. Thank you,
Thank
everybody.
you.
Have a good night.
Good night. We'll move on to the next and the last. The presentation by the Wilmington Police Department on critical incident stress management. Peer support team.
Good evening, Madam Chair.
Chief.
Good evening, Madam Chair. This is Chief Tracy. Tonight, we will have a presentation on a very important aspect of our daily operations, how we support sworn and professional members of our department. I know there was a recent presentation about first responder care and support, and we thought it was important to share with the council and the public on what the Wilmington Police Department is already doing to support our officers and staff who experience trauma and stress. I'm very proud of the work of our critical incident stress management and peer support teams. And I would like to introduce Lieutenant Harold Bozeman and Dr. Dennis Carradine. And they will be giving a presentation and a PowerPoint. And with us also is Inspector Charles Emery, who actually oversees this as the Inspector of Administration. Now I'll turn it over to them to present on important work that we do.
All right, thank you, Chief. Good evening, Madam Chairwoman and council members. We sent a presentation deck over. I don't know if Maribel has that. We're ready to go on that. Like the chief said, for those of you who don't know me, I'm Lieutenant Harold Bozeman. I've been with the police department for 26 years. To give you a little history of my background in stress management, I took my first law enforcement traumatic stress course in 1998. I formally joined our team in 2000. And then in about 2002, I got together with the two other members that existed at the time, and we started to build out the team. I'm currently with the State Fraternal Order of Police Wellness Panel. I'm the liaison to the National FOP Division of Wellness. And together with Dennis here, we teach classes locally on the state level and nationally on police officer wellness, first responder wellness, and critical incident stress management. I've been doing that for about 15 years now, and we've taught at the FBI National Academy, the Florida Mental Health Counselors Association, and several seminars with the Fraternal Order of Police on a national level. I'm going to let my partner here, Dennis Carradine, introduce himself. He's our clinical director and has been for about the last 17 years. So I'll let him speak on his role.
Good evening, everyone. Thank you for having me as well. I actually celebrated my 28th anniversary on the Delaware SISM team as of yesterday. I came in as a young shaven man, and now I'm a older bearded man at this point. But my background obviously is within psychology counseling. I am the second clinical director of this team. First was Dr. Mark Kofke with the Ellesmere VA. Mark had given me the reins about 17 years ago. So since that time, we've developed other teams throughout the state. Besides the one in Newcastle, we have trained close to 2,800 first responders in volunteer fire, paid fire, police, EMS, and several other departments. Currently, right now, our team is about 300 members strong in the state of Delaware, consisting of all those different branches of first responders. We also have an outreach up to 900, which includes Upper Darby, Philadelphia, and a few other of the teams in the surrounding area, which Lieutenant Bozeman and I also teach for.
The next slide, please.
Oh, it's us.
Oh yeah, one more then. So just to go back, we reviewed the January 10th meeting where retired Officer Amy Kivas spoke, and she thoroughly illustrated the challenge of law enforcement work and the toll that the stresses of the job, cumulative career stress, trauma, and things like that take on our police officers. Dennis and I don't disagree with anything that she said. She certainly laid out the need very clearly for all of us. And the effects are very real for police officers. So we're here to talk about what we do in Wilmington and what I've done in about past 20 years as a member of the team. So just a little background on that. Back in about 2000, we had a small handful of members that were trained, but we were very loosely affiliated. There wasn't really a formal program at that time. And there really wasn't wide acceptance at the time in the police culture of mental health peer care. To be honest, at the time, supervisors were unsure about it, and the officers really didn't know how to access it, and a lot of them didn't want to access it. Along came the attacks on September 11th, which really kind of highlighted the need for post-traumatic care for all of our first responders. And that's when it kind of really started to grow as a field among first responders in this country. So we saw the SISM teams that were already affiliated, that were already formed, start to grow, and we saw teams popping up all over the country to support their first responders. So in about 2002, we started to solidify the team in Wilmington and really start to formalize it. We wrote an SOP, standard operating procedure, about the things that we would do and about the kind of services we would offer post-traumatic incident. And at the time, it was really focused on being incident-based. The things that we did happened after a specific trauma occurred, and we didn't really have anything by way of peer support at that time. But we did the stress debriefings. So we grew the roster. We started to increase the quality and quantity of the training that we conducted, and we started offering group debriefing sessions after every critical incident. Since about 2004, Dennis and I have been working together to train our officers. I know one of the points that Amy made last month, and that a couple of the council members were really keyed in on, was whether or not this training should be mandatory, how often it should be offered to our police officers. So I just wanted to reassure the council that since about 2004, every academy class that has come through Wilmington has received a level of mental health awareness training, self-care, critical incident stress management, and peer support training in the academy on about the second or third day, so that we could really give them an idea of how to prepare themselves mentally for the academy and for the career, and to give them some background on what services were available. So we made sure everybody came in knowing that we were here for them, and how to access us. We made it very clear and very simple to access the services that we offer. Next slide, please. Just so that everyone knows, we have right now 19 of our sworn members and several civilians in place that are trained members of our stress management team. In that team of 19, all 4 patrol platoons are represented, several in criminal investigations division, 2 of our canine officers, 2 officers from our organized crime and vice division, and then 2, I believe 2 or 3 from administrative assignments, as well as a couple of our civilians in Wilcom and our civilian police chaplain, Cheryl Alston. So we make sure that we have peers available, exclusive of vacation, obviously, if someone's off. We do our best to have some kind of a peer available, some kind of stress management team available 24 hours a day, if nothing else, for at least the supervisors and commanders that are on duty to reach out for and take advice. And then if there's a perceived need, they'll contact the rest of the team and they'll activate us. But we do have the services available. We make sure that it's available across all of our divisions. And we make sure that we have also included our civilian staff in that. We really highlighted the need to include our civilians probably about 10 years ago, where we had an incident. And at that time, much to our dismay, we didn't have a team in place for our civilians. But some of the civilians were comfortable enough with the program and knew me well enough that they approached Dennis and me, and they asked us if they could get involved in the debriefings, and if several of them could come to the training, become peers themselves. So we really started to build out our team so that it would include our civilian staff as well.
Oh, sorry, and just to jump in with that, the history of critical incident stress management, it initially came out in 1989, was for career fire staff initially. Police came shortly thereafter, but Delaware, or at least the Newcastle County team, was the 3rd team ever developed under the Mitchell model of what it is for anybody for that reference. So the 3rd team that had been developed was strictly for the Wilmington Fire Department. And then after that, it started branching out. When I became a member, like I said, in 1993, we had just started working within the police departments. We were working with volunteer fire, and then the police departments came after that. It wasn't until recently that in all cases of trauma psychology, in all cases of critical incident stress management, that we started recognizing dispatchers and even correctional officers. So even recently, we have trained probation and parole and some of our correctional officers in the state of Delaware. So the whole concept of critical incident stress management has expanded considerably over the past 31 years.
So to give you a little background on our team, like I said, we have 19 sworn officers that are trained now. And of the members on our team, they have a low of 7 years seniority on the department to a high of 26. And then their experience with the CISM team ranges from 3 to 22 years. So we have a wide range of people at different stages of their career that are available for the team. And in order to join the team, just so you have the background on that, they're required to have a minimum of 5 years as a sworn police officer before they apply for the team. And then they're assessed by a panel for their reliability, for their reputation, for their ability to maintain privacy and confidentiality, their reputation among their peers, things like that, their ability to communicate. And then once they're selected for the team, they receive an initial training, which is about 32 hours, and then ongoing specialized training that deals with whatever their discipline is. We have developed courses for dispatchers. We've developed courses for police and firefighters, for EMS. So they receive their initial 32 hours, which is the same for everyone. And then we branch out into their specialties. And then they go through a term of mentorship where they essentially tag along with the team on active calls to learn about the process before they're included and able to respond on their own as peers and supporters. Next slide, please. So we'll talk a little bit about the kinds of things that trigger the response of the team. All right, we have a list that is in our guide about the kinds of things that will prompt us to come out. And the list is obviously not exhaustive. We can't anticipate everything that our first responders will experience or the kinds of or volume of incidents that we'll respond to. So we have a list that's established where we always respond, and then the rest is left up to the discretion of the supervisors and commanders or anyone who perceives a need. If someone seems like they're reacting badly to a specific incident, or if they've had a series of incidents and they look like they're on the decline, we're always open to be contacted and referred by supervisors and commanders for any reason, and we'll have a peer call back and speak to the person they think are affected. So to give you an idea from our list, from our guidelines, we will respond out in every case of an officer-involved shooting, death or serious injury to a member of the department or an immediate family member, the unexpected death of a member of the department, serious injury or death of a civilian following an emergency operation, such as an auto accident, et cetera. Events that seriously threaten the lives of our responders, the death of a child or serious violence against a child, loss of life of a victim or patient following extraordinary and prolonged expenditure of physical and emotional injury. For example, if we have a hostage or barricade situation, or if we have a water rescue with our Marine unit, or we have something where police work for an exceptionally long time to try to save a life or to try to intervene, and that's ultimately unsuccessful, we'll have a team come out and assess that. Any incident that attracts extensive media coverage, any incident where there's a personal identification with the victim and the circumstances. For example, the victims are relatives or friends of the police department personnel, and any incidents that is charged with a profound level of emotion. And like I said, apart from these, supervisors and commanders are free to assess incidents individually on a case-by-case basis and refer us to those. All right, next slide, please. Some of the incidents that we respond to, we determine they require a formal debriefing. So a formal debriefing is when we get the officers together as a group, all the officers in the affected unit or in the affected platoon or team will come together. And within the first 3 or 4 days after the incident, we'll get them together for a formal debriefing, which includes trained peers, trained crisis interventionists, and our clinical director. And the debriefing is a closed session where they're given the chance to express themselves and discuss the incident that happened and have a conversation amongst themselves about the different aspects of it, the things that they found bothersome. And then we share information, we share some education with them about how to return to their functioning, some coping skills, some coping techniques, some recovery techniques and things like that. And I'll let Dennis speak to the clinical side of that. But just so the members here know, there was some question, I believe it was you, President Congo. You asked if these services should be mandated, and there was a little bit of discussion about whether they should be mandatory. And just to inform the council, when there's a formal debriefing following a critical incident where we are activated, we do mandate the attendance at the event. So any officer who's identified as being affected comes to the debriefing, and they receive the opportunity to sit and talk and debrief and get the education. We don't require their participation. And to explain that a little further, if a lot of times just coming to the debriefing and hearing the perspective of the other officers and hearing the clinical advice is usually helpful to the people that were involved, whether or not they participate in the conversation themselves. In all the years that Dennis and I have been doing this, we've only had one officer who flat out refused to speak to us at the debriefing. And even that officer came to us after and thanked us for being there. And he made his clinical appointments on his own. So there is an aspect where the mandated attendance does help, and it is effective. And I'll let Dennis speak to that a little bit on the psychology side of it.
Sure. We have to look at the hours that are involved in this. You have to think of the critical incident as a time bomb almost. And I hate to use that term, but in the world of psychology, we have a 30-day period for post-traumatic stress disorder, meaning that if symptoms of post-traumatic stress last more than 30 days, then we have to kind of look at not only the diagnosis, but we have to look at the long-lasting effects of a post-traumatic stress disorder. This whole program is about getting in quickly and trying to be as effective as possible to basically stop that diagnosis from happening. And and not to bore anyone with the psychological jargon at all, but basically what it does is that it helps them reduce the symptoms, but it also helps them with a little bit of a stigma. If they know that they're going to be with peers, if they know that this is help that's available, then they're less resistant to coming in with us. The idea being is that as long as we could debrief them before that time period's over, then that less likelihood of a diagnosis is going to occur. It's also less likelihood that they're going to require any other services, meaning formal clinical counseling, medication, and what have you. So again, it's kind of on a time crunch. Also, keep in mind that this is something that is done worldwide. So when a large mass disaster, shooting, any of those occurs, whether it's hurricane, whether it's Parkland shooting or what have you, our crews are typically called in within the first day or two so that we could do the same exact thing that we are doing with the Wilmington Police Department.
All right, the next slide, please. So for a long time, all the way back to the 80s that Dennis spoke about, when what's called the Mitchell model of critical incident stress debriefing came out, a lot of the activities around these local teams only centered on specific traumatic incidents. We would only come out if there was something incident related. We would deal with that specific issue. And then after the debriefing, and if there were needed clinical referrals, that would be it. That would be the end of the services. It's only been in the past decade or so, and really ramped up in the past couple of years, where we started working on wraparound services, on peer support, on actual wellness services, in addition to the stress management. So a majority of our contacts at this point have moved from being group debriefings to one-on-one interventions and one-on-one consultations. And we do have peer support now for the non-traumatic incidents. Ms. Kivas spoke about burnout. She called it burnout. It's the same as cumulative career stress. We talk about those things in our education. We offer consultations and support for that. Also, anybody who's facing personal challenge, whether that be relationship challenges, career questions, financial difficulties, if they deal with some sort of addiction or some sort of dependency, we offer our advice and consultations on those kind of challenges. And then other non-critical stressors. There's a huge list of things, and I think that we probably share the same list Ms. Kivas had about those life event stressors that take place. And then we also do clinical referrals. We have a network of providers locally who work with our EAP and work with our health insurance that our officers carry, so that we can send them without the worry about being a fiscal burden, their care being a fiscal burden. We make sure that our providers are vetted, that they're competent to work with first responders. In fact, the National FOP is now working to create a bigger network. They have something called their vetted, culturally competent law enforcement clinicians. So they send out questionnaires, and they send assessors from the FOP to these providers to make sure that they are suited to work with police officers. And the reason we do that is because not everybody is. One of the assessors went to a place in Nashville not too long ago to speak to someone who had applied. And we found out that provider had told an officer, your stories have traumatized me so much that I can't see you anymore. And now I have to talk to somebody about the things you've shared with me. Well, a person who's traumatized by hearing from our cops is obviously not somebody that would be culturally competent, would be deemed suitable to work with us. We don't want to go out and traumatize our clinicians, but we also don't want our clinicians to run away from our police and further stigmatize the process and make them that much less likely to access it. So we've worked on finding clinicians that are able to do these non-critical services, and we've trained our peers now, and there's a national curriculum that's about to come out so we can expand it from critical incident to actual real peer support on one-on-one services being available at all times. The next slide, please. So a few years back, Dennis and I did a roundtable discussion with first responders from all over Delaware and southeastern Pennsylvania. And part of our discussion was a research into why they didn't seek services when they thought they should. And these are the things that are on the screen now that were the four biggest categories, the four biggest reasons why first responders said they did not seek critical incident or peer support services. The biggest one is stigma, right? Nobody wants to be labeled as mentally ill. Nobody wants to be labeled or saddled with a mental illness, especially not in our field. There's so much stigma, so much history in the first responder world going back decades about you hear the ugly terms like the rubber gun squad or riding the desk, and those are the things that really worry our first responders. They have concerns over confidentiality or anonymity. They want to make sure that when they talk to their peers or when they talk to our clinicians or when they talk at a group, that information is not getting out. They don't want their personal story or their personal challenge being shared with the world. The fear of negative career impact. I remember that someone asked a question at the January 10th meeting. I don't remember who it was, but somebody, I believe it was you, Madam Chairwoman, asked if there was any fear among first responders of a negative career impact. I think you said a black mark on their record. And that is absolutely one of the fears that were expressed to us. And in fact, somewhere north of 45% of our respondents said that was one of the barriers to them seeking services from their peers and from clinicians. And then there was a belief that services are difficult to access. In Delaware, they're is a woefully low number of clinicians already, and even fewer of those are taking new patients or available to work with first responders. So those were the four things that we found as our biggest barriers when we did our roundtable discussion. So in order to combat at least the first three of those, we have a system in place of confidentiality. All of our communications by our guidelines are confidential. They're between the person who seeks the services and either the individual or the group of peer providers that talk with them. And not only is confidentiality a matter of our policy, but there's also a Delaware state law. If you can move to the next slide, we'll talk a little bit about the confidentiality. In Delaware, and you can find it under Title 10 of the Delaware Code, Section 4319, there's a confidentiality law. And that's because there's extensive research that shows that privacy-related issues are the biggest barriers to officers and first responders seeking this support. All right, so in order to combat that, how long ago was the law?
The law was actually, so if everyone on council and everyone in the meeting remembers Lieutenant Joe Zerba from the Newcastle County Police Department, prior to his death, which now I believe is 9 years ago, prior to death, there was no formal law, no formal mandate anything for the critical incident stress management. And unfortunately, after Lieutenant Zerba's passing, there was many services that weren't given because of that fear of confidentiality. There was a fear not just of the stigma of it, but also that fear that there might be that black mark against careers. So we had developed a law, that would ultimately ensure confidentiality. And also keep in mind that this program does not work without mental health involved and licensed mental health clinicians involved. Even in the law, it states that the clinical director, whether it's me or someone else, it falls under our license, so that we have to be able to ensure that everyone involved, not just our officers, but everyone involved is held to the standard of our clinical license. So that's what the law basically states, is that everything that is held in confidence is still held in the confidence under the mental health director or the clinical director's license.
So I know there's been a lot of spirited debate in all the legislative bodies in Delaware about confidentiality as pertains to police officers in various contexts. So I just wanted to reassure everybody that in this context, it's very important that this is a mental health process. So this is a health issue. It's considered protected health information, and that's the reason that the law exists. The law is in place to help break down the barriers to the services. It's to help the officers feel more confident and more assured that they can seek these services without their information being released or being discussed or being turned over to the police department, so that they can truly get the care that they need to get themselves well and to get them back on track to being the officer that they can be. Speaking about confidentiality, I had a spirited debate a few years ago with one of the HR professionals from Wilmington. And we were discussing the confidentiality law, but also the standard of confidentiality on our team and in our policy. And the concern of this person was that police officers and firefighters and EMS, they already have a naturally high tolerance for stress. And so the fear was, by the time they're ready to seek services, by the time they reach out to someone and say, hey, I'm stressed, this is really bothering me, they are well beyond what would have been a breaking point for someone in the general public. So the concern was that rather than keep it confidential, if we saw those things, it should be reported to Human Resources, either our Human Resources Division in the police department or to the City Human Resources and Personnel Division department. And that was in order for our HR or city HR to maybe help them with services. The problem is officers won't do that because of the things you already discussed: the stigma, the fear of the negative career impact, the concerns about their own privacy. We find it easier to communicate with them as peers than it is to get them to speak on their issues to members of our Human Resources Division or civilians in city personnel. So she likened it to a pressure cooker. But by the time the officers are feeling that, they've already reached this point where they're an unchecked pressure cooker and they might explode. And the belief was that the confidentiality standard maybe should be examined and go away. My answer to that was taking away peer support, taking away the privacy of a clinical director, and the privacy guarantees of the CISM law would be akin to welding the pressure valve on the pressure cooker closed, and you would almost ensure an explosion. And that's what brings us to what's on the screen now. But did you have?
Yeah, I was just going to say, this is not unique to Delaware. This is in every state. Harold and I were just in Florida at the Florida Mental Health Counselors Association conference, and we taught a class, Warrior to Guardian, bringing soldiers back that go into law enforcement. Each person in our class, and that was online, had also said that, you know, their ability to just talk to an officer seems to be impeded by the stigma and impeded by the lack of confidentiality. Delaware is one of the, sadly, only about 10 states that has a law in place to provide confidentiality for any first responder. Delaware is also a state that actually has a very progressive law. Pennsylvania, which clearly has more clinicians than we do, does not have a law it's similar, but not exactly like ours. Even Maryland, where where critical incident stress management was born with the International Critical Incident Stress Foundation, does not have a law in place that ensures confidentiality at all. And also keep in mind, and when we put it out there, when we're ensuring confidentiality, it's about emotional release that, you know, obviously we have to, by law, you know, we have to inform, we have a duty to protect, we have a duty to warn if there is any illegal activity, if there's any suicide or homicidal threat. This confidentiality is basically their emotional well-being. So if somebody wants to come into my office after a debriefing or whatever, then legally they're allowed to and say whatever they need to say so that they can feel a little bit more normal, if we can actually use that word in psychology.
So what you're seeing on the screen now are some of the things that we've seen as the results of unchecked stress, of unmanaged either cumulative career stress or unresolved critical incident stress. From our perspective as officers and from the chief's perspective, what we see is an increase in discipline. We see cases of alcohol and substance abuse. We see physical health start to deteriorate, whether that's a factor of them reducing their self-care or adopting unhealthier habits or unhealthier eating. We see their physical health start to deteriorate, and thankfully rare in Delaware, but unfortunately 600 plus times last year nationwide, you see law enforcement suicide. From the agency and the city's perspective, when there's unchecked and unresolved grief, trauma, and stress, you see an increase in citizen complaints. You see your uses of force go up. You get more sick time, more lost time, more workers' compensation complaints, especially when they can tie their absences to PTSD stemming from a specific incident. Then you have workers' comp issues to deal with. Potential liability, obviously, from the citizen complaints, the uses of force, and then again on your side, the suicide. So we see this program as a way to try to mitigate the effects of stress, mitigate the effects of burnout and grief, and to try to help resolve some of these things before they become a problem or before they take hold. So that's the need for the program, and that's the need for the confidentiality that's endemic to the program. Take the next slide, please. Or is that the last slide? That may be the last slide. Okay, so if there are any questions about the program or about the clinical side, we'd be happy to take those now.
Thank you, gentlemen. Council members, does anyone have any questions?
No, Councilman Walsh, I would like to make a statement.
Yes, Council Member Oliver.
No, I just want to say I think they did a great job. Thank you.
Anyone else? Well, I'm sure we're going to have you back for some updates. I really do appreciate you putting this. Oh, I'm sorry. Hold on. There is somebody.
President Congo and Councilman Johnson, Madam Walsh.
Councilmember Congo.
Yes, thank you, Madam Chair. Thank you for the presentation. Are you able to share like approximately what percentage of our police force has gone through any official like stress management training? Not training, but has sought help?
So we keep a log annually of numbers only, so that we don't run the risk of exposing anyone for their contacts or for the reasons for contact. And I think on average from Wilmington Police, we probably see, short of a big incident where we have a couple of group debriefings, short of that, we probably see 20 to 25 officers in a calendar year for various things, whether that's a one-on-one or whether it's incident related.
I would say clinically, there's been a rise within the past 8 years, and unfortunately it does work within the CISM wall, but the rise of police in my practice and with my colleagues here, it's been exponential. So more and more of the police department has been seeking out clinical care for your cumulative stress, for any type of incident, but also we're seeing it for what I would consider the normal counseling, relationship advice, that they're coming in because of kids. Several have come in because their kids have gotten to the age where they're leaving the home and going to college, and it's just kind of an adjustment period from them. So we start seeing people coming in more and more often for what we would consider the normal counseling.
And Mr. President, I think we've done a fair job of getting the education out there with the department about what services are available. So on my numbers, on my table where I count officers who access peer services, I do not count those who just ask for a referral to clinical care or ask for a referral to the EAP. So the number I gave you, about 25, are people that seek peer support from the team or people that attend a debriefing. And then there are an additional number who just want contact information for the EAP or for the clinicians in our trusted network.
Can you tell me, do you keep statistics
Okay,
when
thank you.
you're dealing with folks on other things, such as if one does ask for help, does that mean that their chances of committing domestic violence falls?
Ultimately, the American Psychological Council, or American Psychological Association, the American Counseling Association, do take statistics on that. We do report that in certain surveys. We do understand that people that don't seek counseling of such, there are higher rates of domestic violence. If they seek counseling, we see lower rates. Again, that would be put at a more national level at the American Psychological Association, American Counseling Association. Within Delaware, there is a Delaware Psychological Association, and that could be accessible, but I know personally, I don't think they keep the extensive statistics as what the national associations would.
Madam Chair, thankfully on the level of the department, we have a very low incidence of domestic violence being committed by police officers. So it would be tough for us to track. I can tell you in my knowledge, I don't have any direct knowledge of an officer who was involved in an incident or who sought services for their stress or for their career burnout, then turning and having an incident of domestic violence. There's nothing that I can tie directly to unresolved stress or unresolved trauma to a domestic violence incident. So I think our sample size is probably too small, and Dennis's example from the APA is probably much more reliable.
Thank you. Mr. Farrell?
Thank you very much for the presentation. I just had a couple questions. I would like to know, are officers that are involved in critical incidents, such as officer-involved shootings or, say, an excessive use of force, are they tested for substance abuse or alcohol abuse? And the other question is a critical incident. Would a critical incident also be considered an excessive, abusive use of force towards a civilian? And the other question, are medicated officers reassigned to desk duty, or are they still permitted to be out on the street? And my last question is, if an officer does go in for peer counseling or any kind of help, are they compensated? By that I mean, are they on the clock or are they off the clock? Thank you very much.
So I'll answer the officer related ones. When we do the stress debriefings, the group debriefings, the one-on-one, they're obviously able to access our services on duty. We always schedule the debriefings for their on-duty time. And if circumstances are such that they are off duty by necessity, when we have the debriefing, they're compensated for that. The questions about use of force, I can't answer whether anyone's tested post use of force for any kind of substance. That would, I think, would be more of a question for the chief. What I can tell you is that recently I've had a conversation with our Officer Professional Standards, and they have started providing officers who come through their office with information on the EAP, especially in cases of use of force, so that they can seek care on their own and sort of self-evaluate based on their own psychological needs. So those things are both outside the purview of the CISM team, but I can't answer whether they're done. I do know that the commander of the Office of Professional Standards has coordinated with me and spoken to me and Dennis about handing out EAP literature for anybody who's involved in a serious incident, a serious use of force. So I know we're doing that. As to the meds, I'll let the clinical director talk about that.
I currently right now, and I could put this out there as common knowledge, 80 million US citizens take some sort of SSRI, a selective serotonin reuptake inhibitor, which is an antidepressant. So 80 million out of 350 million people are on some sort of medication, which doesn't impede them from working, doing jobs, living their life. It actually enhances life a little bit because it gives them that safety net from either anxiety or depression. If an officer is on something that enhances their life, it helps them with, you know, whatever type of depression that they are or anxiety, I think they could fully function as an officer. But I would question, I don't think many officers out there would be on anything more serious than an antidepressant. You're not going to see an officer on an antipsychotic. You're not going to see an officer on lithium or anything like that, because that would require much more monitoring. They may not be able to function fully within the job itself. So even if an officer was on an antidepressant, I cannot see an issue with them functioning in their career.
May I answer a question on my balance of my time, Madam Chair?
Donald, you've already had 5. And these are really not questions, they're more.
Okay, I had about a minute and a half left. May I ask a question, please?
Go ahead.
Okay, thank you, Madam Chair. I would like to point out that of those 80 million folks that are on some kind of antidepressant, many of them don't carry weapons, and many of them don't have a license to kill. So, you know, there's a certain difference there, you know, versus the general public. I just wanted to put that out there. And what I'd like to say,
that was not a question. That was a statement.
Okay.
Come on. Okay.
Okay.
Time is up. Thank you.
Okay. Could you address that, sir?
Oh, I could address it very, very quickly. I think the folks that may be on, based on just sheer numbers alone, if we look at 1.1 million law enforcement officers, if statistics hold correct, less than 3% of them are taking some sort of SSRI. There are far more people that may be members of the NRA that are on an antidepressant that do carry weapons than would be in law enforcement. So I would haver to believe that that's kind of a radical statement. And I don't understand license to kill. That's not, in my experience, no officer ever got involved in the job to kill anyone. So I can't speak to that, but I could say that, you know, based on just sheer numbers alone, there are far more citizens that may carry weapons than officers that are on antidepressant medications.
Thank you. See no other questions? I would like to thank you both for your time.
I have a question. I have a question, Chairwoman.
Is this Councilmember Johnson?
Yes.
Go ahead, Councilmember.
Just briefly, again, I would thank Lieutenant Bozeman and the CISM team for being here tonight. I guess my only question is regarding the I guess PR or education piece, because it's mentioned that, of course, during academy, they receive information about the mental health services, and also after a critical incident or occurrence. So outside of that, is there periodic information given at roll call or at team meetings, just maybe once a quarter, just to inform officers that, hey, even if you don't have something, we have these services?
Yeah, thank you for that question, and I could say yes. I hate to say Wilmington Police Department has become a second home to me. I think we could say that nicely, but I tend to go over to the department. I bring over food to all of the officers, just simply to say that I'm around, that the team's around, and so on. I have personally taught in the academy since 2004. So each class will get to know me. So ultimately, when I go over just to kind of say hi, to get my face out there, it's also to get the team to understand that we're there. And then we point out team members and so on. So I try to be active. And that's also with Newcastle County PD, Newcastle County, or the city, Newark, you name it. I try to go around as much as I can to inform them of our services.
Council member, as far as your general question about ongoing education, even if it's not done directly by members of our team, every year as a component of our mandatory training hours, there is some mental health and officer wellness and general like psychological self-care training that is part of the 12 annual training sessions that we do put on. There's at least a couple of times where officer wellness is mentioned, self-care is mentioned, and we make sure that we have a list of the providers and their phone numbers and their contact information hung in every division and near every commander's desk so that everyone knows how to contact us and access us when they need to.
Okay, great.
Thank you. DeMarquis, you're the last one. You're ending our conversation tonight, and we'll be sure to get this team back to address us another time. So, DeMarquis, you're on.
All right. Thank you. Thank you, Lady Chair. I took some notes during the conversation, and I'm thankful for what you guys are doing with Warrior to Guardian. That program sounds awesome. Sounds like a great thing. I also took some notes on the 300 members of the stress trauma group. Those 300 members include who? This is Wilmington.
So the 300 serves the size of the police department. I have 19 police officers and a handful of civilians who are part of my team. So just under 25 out of the 300 sworn members are on the team.
So the other 300 members, the volunteer members, come through the state of Delaware. We have officers in almost every single police force or police department here in Delaware. We have members of fire departments, EMS, paramedics. We had a DEA officer. She is retired. We have probation and parole. We have correctional officers. So they're all within the abundance of Delaware. In Philadelphia, those 900. Yeah, they come from the police department, fire department. They come from Upper Darby Police, EMS, paramedic as well. So we have a program where we actually use an app that we can call all 1,200 of those folks in a large incident. And again, I will stress, and I know you didn't ask this question, I apologize, but this is all volunteer as well. So even my services, I have done this 28 years, all volunteer.
since 2004, in Wilmington, every academy class has been trained on the second or third day of training and made aware of the services. Kind of goes back to Chris Johnson's question. At that second, third day of training, what else is happening in the first, second, third day? Is there a lot going on? I mean,
Yeah, there is.
that-
They're being acclimated to the academy and the academy life, issued equipment, learning about the rules. Quite a lot of physical training goes on those first few days. So that's a very stressful time for them. And I think that's probably part of the reason that where the academy commanders schedule us. So when they're making this transition from their civilian life to their police life, and they have all these stressful
20
events,
seconds.
they want to make sure that we're telling them how to cope with their stress, what services are available to them to help them manage their stress. So I think there's some wisdom behind where we're scheduled in the academy class.
And you've been
Thank
doing
you,
this since
gentlemen.
1993, Mr. Carrot, and I just want to thank you guys for what you do, and hopefully we can do things even better in the future.
Thank you so much.
Thank you, everyone, for your time. Thank you, gentlemen, for your presentation today. I'd like to say thank you to everyone who participated today. And it's now 6:51. If you have a sweetheart or somebody you just like and you still haven't had dinner, you still have time to make a phone call and take someone out to dinner tonight. Happy Valentine's Day to everybody, and I hope to see you all soon. Thank you. May I have a motion to adjourn?
Thank you.
So moved.
A second? Well, I'll second it. Thank you. Good night, everyone, and stay safe.
Everyone.